Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.10 Natural remedies for depression. In a given year, an estimated 21 million adults in the United States will have at least one major depressive episode, which is 8.4% of US adults. Many people with depression do not seek treatment, although the majority can benefit from treatment. /r/n/r/n A number of preliminary studies suggest that certain natural remedies for depression may work well for some people, but more studies are needed to determine if they're as effective or more effective than antidepressants. /r/n/r/n If you're considering the use of any supplement or remedy, talk to your healthcare provider first. Keep in mind that self-treating depression and avoiding or delaying standard care can have serious health consequences. /r/n/r/n If you're experiencing symptoms of depression, such as difficulty concentrating, persistent feelings of sadness, and decreased energy, consult your healthcare provider as soon as possible. /r/n/r/n Depression may be treated with medication, therapy, and a combination of natural remedies. This article discusses 8 natural remedies for depression to consider. /r/n/r/n The herb St. John's wort, Hypericum perforatum, has long been used in folk medicine for treating depression, worry, nervousness, and poor sleep. /r/n/r/n Numerous clinical trials suggest that St. John's wort may be effective for treating mild to moderate depression. However, it may not be effective for more severe depression. /r/n/r/n It may take 3 to 6 weeks of taking St. John's wort to notice the full effect. /r/n/r/n Side effects may include dizziness, dry mouth, indigestion, and fatigue. St. John's wort increases photosensitivity, so caution should be taken to protect skin and eyes from sunlight. /r/n/r/n St. John's wort can interfere with the effectiveness of prescription and over-the-counter drugs, such as drugs to treat HIV infections and AIDS, drugs to prevent organ rejection for transplant patients, and oral contraceptives. It can also cause potentially dangerous interactions with certain antidepressants and other drugs that increase serotonin. /r/n/r/n It's not clear if St. John's wort is safe for pregnant or nursing women, children, or people with bipolar disorder, liver disease, or kidney disease. /r/n/r/n Omega-3 fatty acids are a type of fat needed for normal brain function. Our bodies cannot make omega-3 fatty acids, so they must be obtained through diet. /r/n/r/n Studies have linked depression with low dietary intake of omega-3 fatty acids and have also found that countries with higher fish consumption, such as Japan, have a lower rate of depression. /r/n/r/n Some studies suggest that omega-3s, DHA and EPA, together with antidepressants may be more effective than antidepressants alone. /r/n/r/n Cold water fish such as salmon, sardines, and anchovies are the richest food sources of omega-3 fatty acids. /r/n/r/n Fish oil and cod liver oil are also available. Although fish may contain pollutants such as PCBs, many companies filter the oil so that these chemicals are removed. /r/n/r/n Fish oil capsules may increase bleeding risk, particularly if combined with blood thinners such as warfarin and aspirin. Side effects may also include indigestion and other gastrointestinal issues. /r/n/r/n SadenosylLmethionine SAMe, is a compound found naturally in the human body that may increase levels of the neurotransmitters serotonin and dopamine. Several studies have found SAMe to be more effective than placebo for the treatment of depression, but more research is needed. /r/n/r/n In North America, SAMe is available in supplement form in health food stores, drug stores, and online. Proponents typically recommend the enteric-coated form for maximum absorption. /r/n/r/n folate is a B vitamin found in green leafy vegetables, fruits, and whole grains. It's possible to become deficient in this vitamin due to poor nutrition or as a side effect of certain medications, such as anti-seizure drugs or antacids. /r/n/r/n preliminary research suggests that a low folate level may make antidepressants less effective for some people. To this end, increasing your intake of the following folate-rich food may help overcome the deficiency and potentially improve moods. /r/n/r/n The terms folate and folic acid are sometimes used interchangeably, but they are not the same. Folate is the natural form of the vitamin B9. While folic acid is a synthetic form of folate commonly prescribed during pregnancy to prevent neural tube defects. /r/n/r/n While some studies suggest that folic acid may help ease depression, experts warn that the benefit is not conclusive, particularly when folic acid is overused. When taken at daily doses of 15 mg or greater, folic acid supplements can cause irritability, sleep problems, difficulty concentrating, hyperactivity, and depression in some people. /r/n/r/n 5-hydroxytryptophan, 5-HTP, is produced naturally in the body and is used in the formation of the neurotransmitter serotonin. Although taking 5-HTP in supplement form may theoretically boost the body's serotonin levels, many experts report that there is not enough evidence to determine the safety and efficacy of 5-HTP. It should not be combined with certain antidepressants. /r/n/r/n Recent studies have shown saffron may improve symptoms of depression. However, there are concerns about toxicity at high doses and pregnant women should avoid taking saffron. At lower doses, side effects may include drowsiness, stomach upset, nausea or vomiting, and possible allergic reactions. /r/n/r/n Dihydroepiandrosterone, also called DHA, is a hormone made by the body. Low levels of DHA in the body have been linked to depression. Some studies have shown improvement in depression symptoms when taking DHA as a supplement. /r/n/r/n DHA has been used safely for up to 2 years, usually in doses of 50 mg daily. Side effects may include acne and upset stomach. /r/n/r/n Nutritional and dietary supplements are not monitored by the FDA in the same way that medications are. It's important to do some research before starting any dietary supplement and be sure you're buying supplements from a reputable company. /r/n/r/n Nutrition can play a key role in treating and managing depression. A 2017 review of 21 studies suggests that a healthy eating pattern may decrease the risk of depression. A healthy eating pattern included high intakes of fruit, vegetables, whole grains, fish, olive oil, low-fat dairy, and antioxidants. Other recommendations include paying attention to the following: /r/n/r/n Sweets temporarily make you feel good as blood sugar rises but may worsen your mood later when blood glucose levels plummet. /r/n/r/n Alcohol Even though alcohol can temporarily relax some people, the effects are short-lived. Avoid alcohol as it can potentially worsen mood swings, anxiety, depression, and insomnia. /r/n/r/n Vitamin B6 Vitamin B6 is needed to produce the neurotransmitters serotonin and dopamine. Although deficiency of vitamin B6 is rare, people taking oral contraceptives or drugs for tuberculosis may be at higher risk for a deficiency. /r/n/r/n Magnesium Most people do not get enough magnesium in their diets. Good sources of magnesium include legumes, nuts, whole grains, and green vegetables. Like vitamin B6, magnesium is needed for serotonin production. /r/n/r/n Regular exercise is one of the most effective and inexpensive ways to improve mood and can be integrated into any medical treatment plan. Exercise, particularly aerobic exercise, releases mood-elevating chemicals in the brain and can decrease stress hormones. /r/n/r/n choose something you enjoy and will stick with, such as /r/n/r/n start with the amount of exercise that is manageable for you, even if it's less than 30 minutes. Any amount of exercise is progress. /r/n/r/n getting enough sunlight may be effective in helping reduce the seasonal mood changes that occur in the darker winter months. /r/n/r/n exposure to light in the morning, for example, by taking a walk outside, may help the body's sleep/wake cycle function properly. The production of serotonin, a brain chemical that is key in influencing mood, is turned on in the morning upon exposure to light. During the winter when there is less sunlight, serotonin levels can drop, sometimes leading to fatigue or symptoms of seasonal affective disorder SAD. /r/n/r/n Another option is bright light therapy, 10,000 lux. There are different types available, from light boxes to visors, that are typically used for about 30 minutes a day. /r/n/r/n Although they are rather expensive, ranging from $150 to $500, the cost may be covered by insurance. /r/n/r/n If you or a loved one are struggling with depression, contact the Substance Abuse and Mental Health Services Administration, SSA, National Helpline 800-662-4357 for information on support and treatment facilities in your area. /r/n/r/n If you are having suicidal thoughts, dial 988 to contact the 988 Suicide and Crisis Lifeline and connect with a trained counselor. If you or a loved one are in immediate danger, call 911. /r/n/r/n If you are experiencing any of the following depression symptoms that persist, talk with a healthcare provider. /r/n/r/n Some studies suggest that certain natural remedies for depression may be beneficial. If you're considering the use of any supplement or remedy, talk to your healthcare provider first. Natural remedies should be monitored by a healthcare provider for potential drug interactions and effectiveness. /r/n/r/n Keep in mind that self-treating depression and avoiding or delaying standard care can have serious health consequences. Along with natural remedies, medication and therapy may also be needed to treat depression. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.